is Megan. I'm going to be your nurse today. The doctor has ordered a few tests on me. Can I confirm your name and date of birth?
Michael Henderson, 8795.
Perfect. We're going to provide privacy, perform hand hygiene. Alright, so he has ordered a cardiovascular or respiratory assessment, head, ear, nose, throat, eyes assessment, and also a neurological assessment. We're going to start with your neurological assessment. Can you tell me what year it is?
2025.
Okay, can you tell me who the president is?
Trump.
Okay, do you know what you're doing here today?
Yeah, getting that assessment.
Okay. Alright, I'm going to move on. I'm going to go ahead and do your respiratory and your cardio assessment. I'm going to start with that. So, first off, I'm just going to listen to your lungs, okay?
Okay.
You can just breathe normal for me. I'm going to lift your shirt up and go up under your shirt. I'm just going to listen to the side of your lungs. Alright, I'm going to have you set up for me and you can take nice deep breaths. Deep breath. Deep breath again for me. Deep breath one more time. Alright, everything sounds good. There, I'm going to move on to your cardio assessment. So I'm going to listen to your heart, and that's how we're going to start out, okay? Right, your heart rate is at 84 beats per minute. I'm going to move on. I'm just going to have you turn your head to a 45-degree angle. Alright, your jugular vein looks fine. I'm going to check this side. Looks great. I'm going to check your pulses. carotid feels great. And check your brachial pulse. This side and check this one. I'm going to check your radials. Right, we would typically check femoral as well. I'm going to check your patellar. Can I have you slip off your socks and your shoes for me real quick? Right, I'm just going to check your capillary refill in both feet. Looks good. Everything refills in 2 seconds. And I'm just going to check for any edema. Skin feels great. Great color, no discoloration. I don't feel any swelling or edema. And then your skin turgor is normal on both of those. I'm going to go up to your hands and check the capillary refill there. Everything refills good on that side and that side. Skin is still warm, no discoloration. I'm just going to check for any edema. No edema noted. And skin turgor is good on both sides. Alright, so I'm going to move on to your head, ears, eyes, nose, and throat. So first I would just start looking at your head. There does not look to be any deformity. Your pupils look normal, and then your ears look normal. They look asymmetrical. They don't look disshaped. They tend to align with your eyes. Your lips look normal. They're both pink. No dryness, no cracking. Your nose is symmetrical. Everything looks good there. So, have you had any trouble hearing?
No.
Can you hear me fine?
Yes.
Okay. And any trouble with your eyes?
No.
You can see fairly good?
Mm-hmm.
Okay. And then have you had any issues breathing? Any sinuses? Anything that seems to feel like you can't breathe out of your nose?
No.
Okay. In your throat, you haven't had any trouble swallowing? Alright, I'm just going to have you open up your mouth for me real quick. Alright, the inside of your mouth looks good. I don't see any known cavities. It looks moist. And I am going to move on. So I am just going to start with your eyes. I'm going to start by feeling your head, actually. Okay, so I don't note any bumps, any lumps, anything that feels abnormal there. And I'm going to move on to your eyes. So as of right now, Your pupil size is at a 5. So with light, your both pupils should react. So I'm going to start on this eye. I'm just going to shine a light and make sure that both pupils react. Alright, so both pupils did react to that. I'm going to move on to this side. Alright, and both pupils do react there. Alright, so I am going to come back here a little bit. I'm going to give you 3 numbers, if you can just repeat them.
2, 3, 4.
Okay, now come over to this side and check your hearing on this side.
4, 5, 6.
Alright, great. So hearing is good, everything lines up there. I'm going to have you hold one nostril like this and breathe in for me. I'm going to have you do the same with that side. Perfect. So all of that looks great. And then I'm just going to feel your throat, okay? Alright, so the trachea is at the midline. You've had no difficulty swallowing. Alright, I'm going to feel one more time and I'm going to have you swallow for me. Alright, perfect. So the neuro, the head, ears, eyes, nose, throat exam, all of that looks great. You're alert, oriented ×4. You know what you're doing here. Your speech is clear. So all of that is good. We're going to move on to the musculoskeletal exam. So are you having any pain anywhere in your body? Any trouble moving any part of your body? Okay. I am going to start with your shoulder. I'm going to have you extend it, so lift it straight in front of you. Alright? Then I'm going to have you bring it back down, flex it. Alright. And then I'm going to have you extend with resistance. So if you can just, okay. I'm going to have you push back down with resistance. Alright, and we're going to do the other side as well. Same thing, I'm just going to have you extend it on your own first. Bring it back down on your own first. Then we're going to have you do it with some resistance. Alright, same thing. Alright, and then I'm going to check your elbows as well. So if you will just flex it for me, that's good. And then just extend it for me. Alright, I'm going to have you do that with some resistance. Okay, same thing. Perfect. We're going to do this side as well. If you will, just flex it for me on your own. And then extend it for me on your own. And then let's do it with some resistance. Great. Alright, I'm going to have you do the same thing that we did with your shoulders with your knees. If you will bring your knee out for me. Great. And then you can flex it again. And I'm going to have you extend it with some resistance. Right. Same thing on this side. You will just extend this leg for me. And then flex this leg for me. I'll have you do it with resistance. Right, I'm going to also have you invert your foot, meaning you're going to bring it in towards your other foot, one at a time. Then I'll have you expert it, so come out. Right, I'm going to have you do it with resistance. Invert, expert, and then let's do it with resistance. Alright, perfect. One more thing for me before we get out of here. I'm going to have you stand up for me. Alright, I'm just going to have you stand straight in front of me and close your eyes for about 30 seconds. Alright, you can open your eyes. Alright, balance is okay, just a little wobbly, nothing too concerning. And we're going to have you do a little bit of a sobriety test for me. I'm going to have you walk a line heel to toe. have you walk back on your heels for me. Like this. Alright, perfect. Balance looks okay. And you are all done here. Do you have any questions for me?
Well, thank you.
Thank